Next, we will have our second panel. We will discuss what the report had to say in relation to so-called conversion therapy. We will have another of the report's authors, Dr. Conor Buggy, joining us for this discussion. We'll also be joined by Ailsa Spindler from the Gay Project and Alan Edge from LGBT Ireland. I think they're all joining us now. Yeah. So Conor is an associate professor in occupational and environmental studies at University College Dublin and a member of the National LGBT Federation Research Subcommittee. Hello, Conor.
Evening, Anna. Thanks for letting me in here this evening.
Thanks for being here. Ailsa Spindler from the Gay Project in Cork has spent most of their working life in the not-for-profit sector and was the first executive director of ILGA Europe at a time when EU-wide LGBT legislation was taking effect. Hello, Ailsa. Hello, Ailsa.
Hi, Anna. It's lovely to be here. Can I just say, in case there's any Bulgarians, I'm wearing red and white threads because today is Baba Matza Day, 1st of March. So happy Bulgaria Day.
Thank you for that. Then we have Alan, and Alan is the newly appointed officer for the Ban Conversion Therapy Campaign for LGBT Ireland in partnership with the Rainbow Project Northern Ireland. He has been active in a number of campaigns, including Repeal the Eighth and Marriage Equality, and he is one of 3 LGBT plus councillors on South Dublin County Council, where he sits as an independent. Hello, Alan.
Hi, Anna. How are you? Great to see you.
Great to see you all. Thank you all for being here. Conor, I'm going to start off with you. What does the report tell us about support for a ban on so-called conversion therapy in Ireland? Can you talk to us about that?
Yeah, sure. I mean, I think when people see the report and they get their hands on it, they will see that this is a very positive outcome from the survey. Overall, nearly 2/3 of the people who participated in the survey indicated support for the banning of conversion therapy, with less than 20% indicating that they disagreed with the ban, which I think this is hugely important. But when we look at the breakdown of this, and I think linking back to Hannah Tiernan's question on kind of, the gender breakdown of the participants, when we look at this and we look at age groups as well, this is really important. So we've seen consistent support for the banning of conversion therapy from both men and women participating in the survey. There was no significant difference between them. But in particular, when we look at the 18 to 50-year-olds, that support, so, the average for the whole survey was 2/3. But when we look at 18 to 50-year-olds, the support for banning conversion therapy was at 75%, which is really, really positive. And I know, we can talk about, educating the public, and, we've different age categories that we checked through the survey. And not surprisingly, there was somewhat diminished support in the older participants in the survey. But even when we look at that older age category of the over 66-year-olds, there was still nearly 50% support for the banning of conversion therapy. Only 25% of those over 66 that took part were against banning it. So I think this does give very strong grounds. It does give data that the people in power need to say, yes, let the people are behind this. We can ban this conversion therapy. So I think from the report, it's very we can see there's strong support for it.
Okay, so you find the report really encouraging. Alan, 64% of participants. Before I come to you, Alan, I want to come back. I wanted to ask Chris or Conor about this. 49% agreed that it is impossible to truly change one's sexual orientation, and less than 1/3 of participants disagree with this statement. Is this consistent with what you expected to find, Conor?
Well, when we approach surveys like this as researchers, even though we are LGBTI researchers, we have to go in and, try not to bring our own biases in, try not to have any expectations with what the results are going to say, because inherently, if you go in with expectations, you could be quite disappointed. And, I think when people are going to see the report as well, they're going to be surprised by quite a number of the findings. And I think one of the things we probably should have mentioned at the start is that while the report is overwhelmingly positive, there is a warning in the report to say, some of the findings, particularly some of the direct quotes from individuals, may be, you know, triggering, and they may be quite disturbing. You know, we face these things all the time. So as researchers, we have to sit down and look at this and try not to bring our emotions into it. And even though still, you know, our heart might be wrenching when we read some of the comments that have come through. So did we expect that finding? You know, I can't say yes or no, but I can say that pretty much this is the first time this type of research has been done in Ireland. And I think from my perspective, looking at it, I was quite pleased that that was there. But also when you look at that data in more detail, when people go to that section, you know, yes, 49% agreed that it is impossible to truly change one's sexual orientation. But if we look, there was another question along there as well that, you know, the statement was individuals choose their sexual orientation. But 2/3 of people disagreed with that. So 2/3 of people said, no, people, you know, people don't choose their sexual orientation. So I think when you do look at the data, you have to look at all of the kind of questions in that section and kind of get an overall picture. So I think that's really important. So when people do read this report, go in with the clear head. Don't bring your biases with you, and remember, you know, we're LGBTI researchers looking at data on our community. It can be disturbing, but overwhelmingly the report is positive.
Yeah, and I spoke to Chris earlier on about that percentage there, and he was explaining to me that while 29% disagreed, 22% reported that they neither agree nor disagree with that statement. So that 49% isn't the full picture.
Exactly.
Alan, 64% of participants agreed that the government should prohibit the promotion or practice of conversion therapy by health professionals in Ireland. Can you tell us a bit more about your work in campaigning against conversion therapy?
Sure, Anna. Yeah, first thing to say, as Connor says, it's really positive to see that figure, and not entirely surprising, because there does seem to be a great deal of opinion in support of a ban. You know, we've had a huge amount of work has been done on this already. I'm in post since November, but prior to that, a huge amount of work done by the Anti-Conversion Therapy Coalition. Senator Fintan Moorfield, of course, had a bill in the Senate, and there's been very broad support behind that. But I think the issue facing it, well, there's a few issues facing it. The first is, how do we deal with the question that a lot of people ask when you bring this issue to them, which is, surely it doesn't happen here. And I think that's a really important issue for us to address. And I think this research actually is really helpful in that regard. But there's also an independent piece of research that's been commissioned by the government. And that's something that we, as part of the campaign, will be supporting in every way that we can. Obviously, it'll be an independent piece of research, but we need, as Connor says, that data. And we need the evidence from people who've been subjected to these practices. And we're using the term practices rather than therapies, because
Sure.
people often think of therapy as a sort of clinical setting, and we know that these practices are on quite a broad spectrum, and we need to make sure that any legislation covers all bases, and that no one's left behind.
And what's coming up in this campaign, Alan? Can you tell us?
Well, so the first thing is, in terms of the research, it's extremely difficult, I think, to find people to talk about this experience. So you have to understand just how traumatic it is. Now we're kind of fortunate that we have the support and we have the testimony of people who've been through historic conversion therapy, and they're able to help us in terms of the sort of interventions that take place, but also in terms of the long-standing effects. But I think what's really important is for us to find people who have been subjected to these practices recently, because we need to get a clearer picture of what's going on right now in Ireland. And in order to do that, we've got a fantastic coalition. There's a steering group that we've pulled together of various regional groups, various activist groups, including NXF, TENI belong to, as well as clinicians and practitioners. And I think pooling our resources, as it were, we'll be able to cast that net quite wide to ensure that we have a sufficient number of testimonies in order to inform that research and inform the legislation.
Okay, great. Ailsa, you have a lot of international experience in advocating for advances in LGBT plus legislation. Is there anything that Ireland can learn from other countries to achieve a ban on conversion therapy?
Certainly, I hope so. Anyway, the first thing I think is that conversion therapy bans are not new. I think the first country to ban any form of conversion therapies was Brazil more than 20 years ago. There are currently around about 20 countries around the world that have got some sort of ban, and that number's changing very fast. So both France and New Zealand have introduced bans this year already. And I think what Ireland can learn is to look at the different approaches, because particularly in the early years of introducing these bans, countries often just made it a ban on members of the psychiatric profession or rather restricted medical approaches. And I think it's absolutely important that in Ireland we include everybody that acts as a practitioner, a therapist, as somebody who uses conversion therapies and practices. And I think the elephant in the room is the religious community. Obviously, we know in Ireland the church has a huge impact on people. And already in some other countries, when the legislation was being introduced, churches tried to get a ban or an exemption from the ban because of free speech, freedom of thought, all those sort of things. And we must keep reminding people that conversion therapy has been classified as a type of torture, and that trumps everything else. That trumps free speech, religion, assembly, all those things, because it's an absolutely fundamental human right. And I do think there will be some, there's already been some pushback in Ireland when this has been talked about. And I think we must be very prepared to have a strong argument as to why it does cover people who are sent to see the priest. Here in Cork, I could introduce you to people who had really traumatic experiences in their teens, being told by priests that they were evil, but that God can save them. And if they pray together and, you know, laying on of hands and all sorts of stuff like that, then they'll be cured. That is conversion. That is conversion therapy. And we must make sure that it's included in the legislation.
And Ailsa, how can we ensure that any legislation banning conversion therapy is as inclusive as possible?
Well, it is all about the words. You know, we really have to make sure that we get the wording right. And technical bills, technical laws are always difficult because there will be people arguing for different sets of wording to either favor their group or to disfavor another group. And I think that's why the research that we're involved in at the moment is very important. We're already looking at ways that the wording can be shaped when the bill goes through the erectus. And I think it's got to really be as inclusive as possible. As you say, we don't want anyone left behind. It's got to cover all these different aspects. It's got to cover gender identity, conversion, as well as sexual orientation. It's absolutely important that it does.
Absolutely. I was just about to say, often people think conversion therapy is just about making people straight, but it is also used against trans and non-binary people.
Yeah. And if I can just say, what we have to also be careful about is that we don't ban things that are good. So we don't want to ban discussions between therapists and patients around things like, you know, gender change, gender transition. If you're going to allow that, you mustn't allow conversion therapy to say, well, they can talk to them about that, so we can talk to them about that as well. It's really important that we get the wording very, very precise.
Yeah. And Conor, was there anything else in the report that stood out for you in relation to this topic?
Well, I mean, when you go through the report, I think people are going to find they're going to be reading it for quite a while. And so I think everybody as an individual will probably get something that stands out. Myself in that section, I think some of the quotes from individuals were quite hard to read. And I'm not going to say them out loud, but I don't want to give them airtime, but they were quite hard. And you know, when we look at that type of data and we look at these comments coming in, we have to try and remember that this is a minority. These comments came from a minority. our data says the majority are supporting of conversion therapy, or supporting the banning of conversion therapy. And I even hate the term therapy for it. So I think just when people are reading it, just keep that in mind, that whole section. And people are going to be poring over this data for quite a while. The report says a lot, and I think even myself, having been close to the data with Chris and Kath and the rest of the researchers, we're still, every time we look at it, something new pops out at us.
Yeah, Alan, have you any final thoughts on the report?
Yeah, just to say, I think one of the things that is really highlighted, you talked in the previous panel about the disparity in terms of attitudes, and it's summed up really in those comments. And like Conor, I'm not going to repeat them, but certainly demonstrating a tendency to pathologize, and I think that really does relate to conversion practices. But I think clearly we have these situations, faith-based interventions, and we kind of know the shape of them. I think the challenge for us, and this I hope will be something that we'll meet when we have more people talking about their experiences, is where a line is crossed. So Ailsa made the excellent point that we need to be quite clear, that proper therapeutic support, for example, with people around their gender expression, gender identity, is fine, but we need to be absolutely clear ourselves where that line is, and when that line is crossed. And in some ways, I think those interventions concerning gender identity and gender expression are where the issue may be more nuanced, and where we just really need to have a really good grasp on it. And I think that's the only way that we're going to make sure that no one's left behind, and that it's everyone or no one, basically.
Okay. All right. I don't think we've any. We do have. Let me just check.
Yeah, there's a comment from John there, one of the researchers as well, and he says it's very important to include the comments, even though they're hard to read, and it's very true. Yeah, because we ourselves as a community, we need to be aware of what is being said about us, and so that we can then use it to, and create change.
Sure. Okay. Well, listen, I'd like to thank the three of you for joining me, Conor, Alan, and Ailsa. Thank you so much for taking part in this discussion.
A pleasure. Thank you.
Thanks.
Thanks, Anna.